Examination of the peripheral vascular system. This examination will commence by checking the pulse, specifically the radial pulse, to determine the heart rate. The radial pulse is 88 beats per minute. Now the doctor is going to check the blood pressure in 3 different positions, which include sitting, lying and standing. Those 3 positions were chosen to check for postural hypertension. Sitting position. The blood pressure during sitting was 103/70 mm mercury. Supine position. The blood pressure during lying was 104/70 mm mercury. Standing position. The blood pressure during standing position was 103/69 mm mercury. Inspection of the hand. The doctor will check for any scars, masses, lesions or discolorations on the skin. Palpation of the hand. The doctor will palpate the hand for any temperature differences. The doctor will now perform the Allen's test on both hands to check for radial and ulnar arteries patency. A close-up view of the Allen's test. Note the increase in redness when the arteries are released. Nail blanch test or capillary refill time, which is done on the nail beds. It is used to monitor dehydration and the amount of blood flow to tissue. The normal capillary refill time is 2 seconds. Close-up view of the nail blanch test. Clubbing. Clubbing is a physical sign characterized by bulbous enlargement of the ends of one or more fingers or toes. The doctor will now examine the eyes. Checking for anemia by asking the patient to look up, and jaundice by asking the patient to look down without moving his head for both. Close-up view of the eyes examination. Then examination of the mouth, checking for glossitis by asking the patient to open his mouth, and central cyanosis by asking the patient to raise his tongue. Close-up view of the mouth examination. With the patient in cardiac position, the doctor will start with inspection of the feet, checking for any scars, masses, lesions or discolorations on the skin. Close-up view of the feet examination. Palpation of the feet for any temperature differences. Then palpation for pitting edema. Pitting edema leaves a dent in the skin after you press the area with a finger for about 5 seconds. The dent will slowly fill back in. The doctor will now move on to check for bilateral pulses, which include radial pulse, brachial pulse, carotid pulse, which will be checked separately, Femoral pulse. Popliteal pulse. Posterior tibial pulse. Endosadospedis pulse. Now the doctor is going to check for bruits over the carotid artery using the bell of the stethoscope. With patient's head elevated 45 degrees, the jugular venous pressure is now going to be measured. The doctor will first look for the jugular pulsation. Using a centimeter ruler, the vertical distance between the angle manubriosternal joint and the highest level of jugular vein pulsation will be measured. Close-up view of the measurement of the JVP. The JVP here is 4 centimeters water. Examination of the precordium. Examination of the precordium is going to start with inspection for any scars, masses, lesions or discolorations. Close-up view of the inspection of the precordium. Then palpation for thrills. Close-up view of the palpation of the precordium. Then for apical beat location and measurement, point of maximal impulse. The doctor is going to locate the apical beat by palpating each intercostal space to reach the 5th intercostal space, mid-clavicular. The apical impulse would be measured. Close-up view of locating the apical impulse. The apical impulse is normally 2 to 3 centimeters and here it was found to be 2 centimeters. Also the distance between the apical impulse and the sternum will also be measured. The doctor will now percuss for heart size. Close-up view of the percussion for heart size. The doctor will now do auscultation over the precordium with the diaphragm of the stethoscope on 4 areas. pulmonic area, aortic area, tricuspid area, and mitral area. Then in a reverse direction on those areas, but using the bell of the stethoscope. Lastly, the doctor will ask the patient to lean to his left side to check for mitral stenosis. Then sit up leaning forward to check for aortic regurgitation. On behalf of Texila American University and students of MD4 2014 to 2015 batch, we would like to thank you for watching this video.